motivation dies away in 6 months, in 4 months. Just the discipline, you never disobey your end time, that I'm going to wake up and then wake up.
How do you keep yourself motivated for the journey?
Whatever, how much ever you can do. Push yourself past your limits. Just aim for the sky. Whatever you do, don't stop. Here is also a great source, great for Marrow RR users and for Cerebellum users. But for DAMs, DVT is much easier. No matter what happens, you will not get up. No matter what happens, you will keep pushing. Whatever you do, you don't stop. Whatever you say, you follow it up with your actions.
So did you also do DVT, and like how did you revise it? DVT how many times?
If you've got 150 and you're repeating, you don't have to study for 10 more questions. Like you don't have to study for 10 more questions to get 160. You have to study for all the 160 again. Complete 8 months, you can't just be solving custom modules because it will get repetitive. You go for the whole modules. What you do, start with the major subjects. They are very high. Surgery 56 modules, medicine has a lot of modules, but it will cover PACO also in it. Schedule like 10 days won't make a difference, right? Just use the extra pressure to put pressure on yourself and cover more.
Hello. Hi, Dr. Sumit.
Hello. Hi.
How are you doing, bro?
Yeah, very nice.
So, counseling is started.
Finally.
Finally. So, I asked this question to all the toppers, like, how's the life after getting the good results?
Best 3 months I've had.
Yeah. Now 3 years grinding will start.
Yes, for sure.
True. You can just start in 1 or 2 minutes so that other people also can join the separate group link. Yeah, so I think we can start. So, hello guys, my name is Dr. Deepak, as you know, and today we have with us Dr. Sumit, who got a rank of 139 in NEET PG 25. So, first of all, congratulations, Sumit, for the amazing rank.
Thank you so much.
Thank you so much for joining this webinar to guide people. Thank you so much. So, let's start. Like, how did you prepare? How you started your NEET PG preparation?
So when I was in 3rd year, I got to know that the university exams weren't really that important. If you score 60%, 70%, it doesn't really matter. Like if you pass, I'm also going in 3rd year. My batchmate is also going in 3rd year. The other person is also going in 3rd year. So I decided, yeah, I'll just start preparing for NEET PG consistently since 3rd year. And if I turn a blind eye towards the other stuff, it's okay. So I started in 3rd year and then never looked back.
What was your college name?
BJMC Pune.
Okay, BJMC Pune. So, and when did you start seriously for NEET PG preparation?
I started in 3rd year.
3rd year only. And how you choose your source?
So already like people were studying from Marrow, DAMS, PrepLadder. There were a lot of options, but I actually started in mid 3rd year seriously. So I thought, yeah, I'm a little behind. I have to cover 19 subjects till internship starts from now, and that is like half of 3rd year and final year. So I chose a more concise source, that was DAMS, and I just did that because anything more was not possible.
Okay, so DEMS live classes with the Qbank from Marrow?
Yes, Qbank from Marrow, and online classes. I took DAMS online classes.
Anything BTR or something?
No, I didn't do BTR because those who do DAMS, the main notes from
DVT.
DAMS, yes, DVT has the same tables.
Yeah.
So it's already in your visual memory. So it's very easy to do that.
Okay, so DEMS and DVT you did. Okay. How was your GT journey?
So GT journey also yes, Jayashri, I did DAMS back to basics. My GT journey started in around final year, mid-final year. I started my first GT, and for GTs also the platforms play a role. If you directly go to Marrow GT, it will be tough. If you don't really have the confidence, I'll suggest you go for DAMS GT. They are relatively easier and they have video solutions, so reviewing is also easier. So I started from DAMS, and then I scored around like 90, 100 in my first GT's essay. It was because DAMS is easier than Marrow, and then I just started increasing the frequency. I think around internship mid, I reached around 130, and then it started ticking up.
Okay. And how you used to analysis your GTs?
Yes, so the analysis part is very important because after giving the GT, we have to see that whether your mistakes were factual errors or they were application based errors. Factual error means that you weren't simply able to recall. They ask you straightforward fact, char options, you weren't able to recall. So that's a factual error. That means your revision is lacking. Application error means that you knew the information somewhere, but it was a long stem questions. You weren't able to apply the information you knew. So that means your concept is somewhere lacking and you need more practice on that topic, like more question solving, or maybe the video lectures you need to revisit.
Okay. Did you made any choti copy or something like that for GTs?
For GTs, I did make a mistake book, but because internship attempt, so I didn't have enough time. So just used to screenshot my mistakes, that too only the relevant ones, which are outside my notes. I would just leave them, just the screenshots, and then paste it in a digital notebook.
Okay. And how you made your revision plans?
Revision plan should be very strategic for NEET PG. Like you, let's say you have 1 year for it now, so you have 8 months. So the first read, you should aim for 6 reads. If you aim for 6 reads, you will go for 5. Okay. So if you aim for 6 reads, let's say that out of the 12 months, you should finish the first read in 6 months. Then you probably can go for 6 reads. If you don't finish in 6 months, let's say 8 months, 9 months, then you'll have to reduce your number of reads. And it's like this, that the number of repetitions will determine your rank. I think that this exam is about quantity over quality while studying.
Yeah. And the competition level is also too much.
Too much, too
One or
much.
two questions and you rank hundreds, thousands away.
Thousands.
Yeah, true. So what do you think? Like, what was your motivation, and how was your usual day look like before the 6 months before the exam?
6 months before the exam, like completely during internship, I had left everything, every single thing, whatever I liked, because internship has long hours and there is just some amount of energy in you. So I left everything, literally everything. I did not do anything, just studied. And in the end of the day, when you're really tired, then phone calls with family and all that. So the day looked like 9 to 5 job. Then I came home and I slept for 1 2 hours, woke up, and then till the night I just studied continuously. Only
Okay,
breaks during dinner and all of that.
okay. And after completing internship, you might have got few months or not for
Yes,
the
yes, I had few months. For all the interns watching this, I need you to pay attention because you need to take repost in your internship. You need to take 6 weeks minimum repost in your internship because the NEET date comes for us. It was 15th of June when it first came out, and the internship completion date was 31st of July. So you get 6 weeks extra after your NEET to complete your internship. So you should take that definitely. So during this time when I took my repost and the extra months, I was uh, in the morning, I used to go to the library. There's a thing called bed to table time. Everyone should follow that, I think, because in the morning, what we do, we get up, we get ready, breakfast, and already 2 3 hours we spend doing this. So bed to table time is a concept. Like you wake up, if your bed to table time is 30 minutes, within waking up 30 minutes, you should sit to study, and the minimum that is, the better it is for you. So I used to aim for 45 30 minutes and sit to study while after waking up.
okay. Like, how did you deal with the burnout?
So burnout was a real thing for me because duty was really hectic. But it's the same thing. Like if you have your reason, now everyone here is a doctor and they want to go to the next level. PG, you have to do, you want to do. It's an opportunity. It's not it's not a compulsion. Opportunity to go to the next level. Like stipend only you will get 1 lakh per month. After that, limitless opportunities. You're a doctor, you're living your dream. So it's just that you have to make your family proud. Do whatever it takes. I always say this, do whatever it takes. Find your reason why you want to like crack this exam, do whatever it takes.
True. So yeah, guys, my questions are over. You can unmute yourself and you can ask your queries, or you can put in chat box. I will ask. Yeah, Chitra.
Hi, congratulations on your great rank. I wanted to ask, you talked about revision. You did say that plan 6 revisions. So how did you go for revisions? Because studying the same thing again and again is a tedious task. मतलब पढ़ के लगता है अरे ये तो आता है तो एक ही चीज को बार बार कैसे पढ़ना है.
So if you want to tackle that, I suggest ki what I did in my first read or second read, I started making questions. Like if you're reading a topic, let's say you're reading pathology, any topic, whatever you're reading, I made questions line by line, like for in detail. And then after in your second read, you just see the questions and you see if you know the answer. If you know the answer, that means you remember that stuff. You can pay a little less attention and you will be practicing active recall, spaced repetition through this. You just make your own questions if you find reading the same thing tedious. But there is a concept called visual memory. The more times you see the same page, the easier it is for you to recall. And this is a real thing. I am telling you because in the end, you have 1 month to revise 19 subjects. That is with GTs, with PYQs, that is very less time. So you're going to get around, let's say, 1.5 day per subject. So the more times you've seen the same page, the easier it is going to be for you to read. And in the last month, I'm telling you, you need to read everything. Like, as a timeline banana, like 45 days from the exam, you leave. So 30 days, one read, and last 15 days for your last minute revision. So in the last 30 days, you have to read everything, and 15 days, you have to consolidate what you read.
Did you also do like I am also doing dance is my main source. So did you also do DVT and like how did you revise it? DVT how many times? Like it is
Okay,
must to
so
revise DVC.
those who want to revise DVT and or BTR, I've got a great strategy. While watching the videos, while filling up your notes, you see if you remember the things the ma'am or sir is telling you, you write them in normal blue color. If you don't remember, write them in red color. So while you're, I will always advise everyone to go for main notes or RR till the end because NEET PG last year was difficult. Everyone knows that it was a level up, one level above all the years. So you
Yes,
should,
yes.
yes, so you should go for main notes or RR till the end. And DVT and BTR, you can use that in the end when there's no time, you can just see the red points. All the things you've written in red because these were the things you don't remember. Entirely all my strategy was based on active recall and filling up the loopholes that I have. Whatever I didn't remember was the only thing I read in the last 15 days.
My last question: did you give GTs in your last 10 days or last 1 week of exam?
Yes, I gave a GT and I was planning for one more, but I decided not to because it was more like I gave sections then. It was more like I didn't want to go into overconfidence if I get good, or I don't want to go into underconfidence if I get bad. So I planned for 3 GTs. I gave one and I gave 2 half GTs just to get in the exam mindset.
Okay, thank you so much.
Okay. Shoaib. Shoaib Ilyas.
Hello, sir. Hello,
Yes.
sir. How to concise the notes which we made in first revisions?
So, which notes are you using? Can I know the platform?
I'm using Cerebellum live classes.
Yes, so Cerebellum has slightly bigger notes, but I guess as you go forward, you will be more, or it will be easier for you to read the notes, because if you read the same page again and again, you can read the whole notes. And if you're talking about concising, I would say don't go for concising in your first or second read. Go for it in your third read, because
Okay.
third read onwards, you get to know what's actually important, because it should not be the case that you strike out something in the first or second read. You thought it was unimportant, but it was high yield. So that mistake you shouldn't do. So in the third read onwards, what you do, you you'll be solving PYQs by then. You'll be giving GTs. Third read is quite ahead, like 6 months, 7 months deep into the preparation. You'll have a clear idea what is important, what is not important. Then you can just strike out pages. If you have the confidence, just go for it. Don't worry.
Okay, sir. Thank you.
Yeah, dream big. Yes, we should dream big.
Good evening, sir.
Good evening.
Sir, congratulations for the great rank you've achieved. Sir, my doubt was that how did you practice previous year questions? Because I have solved multiple times the previous year questions, but when it comes to revision, I don't know how to revise them. It's very difficult to me, for me to open each question bank and then study for the previous year topics. How did you deal with previous year topics and questions?
So the main thing you want to look at is the topics, not the questions, because the questions won't be repeated as such. The topics are the high yield topics. So whenever you solve, you keep solving the PYQs and the PYTs, you get to know. Like in OBGY, you get to know that the fetal head circumference is a very highly asked topic. So you just have a mental map of that. See, what mistake people do is they go and they sort of start learning all the PYQs with the questions and the answers. You should not go for rote learning. Yes, speak.
Okay, sir. So did you like mark those topics in the notes, or you just kind of got it that these topics are asked usually?
I did not actually mark anything in my notes. It was just mental memory, because you can't really go for those selected topics as a just study them. More of a holistic approach will help you, is what I feel.
Okay, sir. And sir, can you please guide like which subjects we cannot we should avoid doing question banks actually, because I'm a working doctor, so I feel sometimes I don't like to do the question bank of few subjects. Can you ponder upon that?
Are you referring to Marrow?
Yes, sir.
So in Marrow, PSM has a lot of irrelevant stuff. Like the Qbanks, you can just skip PSM as very irrelevant stuff, but do not skip biostats and epidemiology. You need to focus on them. The rest you can just solve what you think is relevant. Then we come to ANAT. ANAT has 68 modules, surgery has 56, I think. So that just doesn't add up, because if you spend 60 modules ANAT and surgery 56, what will you choose? Surgery you will choose. Na? So that you can skip. I think you should aim for 70% of the Qbank. Solving 70% is very good. And solve the Qbank only till like the first 6 months of your prep. And then after that, you can go for more of a custom module subject test kind of a preparation. MCQ, sorry.
Okay, sir. Thank you, sir.
Yes.
Sharanch.
Hi sir, congratulations for the great rank. Just
Yes.
wanted to ask कि किसी भी सब्जेक्ट को अपन को बीच में 19 सब्जेक्ट्स में एक साथ कैसे रिवीजन स्टार्ट करें, लाइक मैंने एक सब्जेक्ट फिनिश किया तो शुड आई सेकंड सब्जेक्ट स्टार्ट किया तो फर्स्ट सब्जेक्ट तो मेरे को रिवीजन का प्लान पूछना था कि रिवीजन्स को कैसे करें.
So I had a great plan for that too. I think you all should note it down. See, during our first, second reads, 6 months we get to cover all the 19 subjects. But after the 6 months, you won't remember the subject you studied first. So what you do, let's say you start today with OBGY. I studied OBGY today, and you mark the day. Exactly after a month, you leave one day, only one day. One day you have to read rapidly everything, whatever you've covered from OBGY. OBGY is a big subject, so you can leave two, but keep it to a minimum. Like after 1 month, you cover that subject again. Let's say your first read gets extended to, let's say, 7 months, 7.5 months, but still it's not your first read anymore. It's two reads, right? Because you're revising the same subject after a month. So follow this strategy. It really worked for me because there nothing was, I say, new to me after my first read.
Okay. Thank you so much, sir.
Yeah. Anyone else? Did you do? Have you made any 20th copy or ended?
Yes, I made a 20th copy. It was whatever the stuff I told you. I wrote down questions for everything and revised them like that. And whatever I didn't remember, I used a special highlighter and highlighted them, highlighted the points. And whatever was highlighted, I read only that in my last 15 days. And it was very detailed. So it took me a lot of time because imagine whatever you don't remember, you've highlighted using a green highlighter. So you read only that. That was my 20th notebook. Very simple concept for me.
Okay. Iqbal, ask.
Congratulations, sir.
Thank you.
Sir, can you tell me one thing, sir? Which subject we can do from modules, sir? Which is a narrow module. Which subject we can do from narrow module wise? Question bank.
Okay, so you want to know which subjects you want to solve the modules for, high yield modules you want to know.
Yeah. So now,
Yes.
sir, now I am doing like high topic from the Marrow Qbank and custom module. So, but I am thinking to do some of the subjects from whole module. And so that can you recommend some subject that you have to do completely from Marrow Qbank?
Yes. So now you have 8 months to your exam, right? So I will definitely recommend you go for the whole modules. Also continue whatever custom modules you're doing, but go for the whole modules because you have time. Like complete 8 months, you can't just be solving custom modules because it will get repetitive. You go for the whole modules. What you do, start with the major subjects. They are very high yield. Surgery, 56 modules. Medicine has a lot of modules, but it will cover patho also in it. OBGY also has around 60, 70 modules, very high yield. So start from those and solve whole modules till like your first or second read is done. After that, you definitely stop the module solving, go for subject tests, custom module, GTs more than only modules.
Till March, I can do this module wise. Till March. If
Till March,
exam in June.
Assuming exam is in June, I think you should stop a little earlier. Like
For
4 months before the exam, you should stop the whole module approach.
till Feb.
4 or 5 months before.
And sir, you too. And what about medicine, sir? Can we go for the module wise medicine? And
Yes, you can definitely go. Just be sure of which modules. There's a module like juvenile on JIA, juvenile idiopathic arthritis. Those are really not that high yield, so you can skip those. Go for only the ones that you know. Now there's a module on sarcoidosis, so you should definitely go for that. 15 questions on sarcoidosis can definitely solve.
And sir, what about minor subject?
Minor subjects also same. Like till Feb, you solve however much you can. Go for prioritize major subjects first, PSM and all the 4 subjects in final year. Then go for the minor subjects, and then you can go for the first and second years because first and second years has a lot of modules on Marrow, like a lot.
Because second year is little bit high yield, so I will go for it. But sir, what about first year?
Yes, first year I left. I also left first year. I only did around 15 modules of biochemistry.
At last we can do first year, and the PSM, though you told it is not that high.
Yes, PSM, the
But
selective topics I told, biostats and epidemiology, you should focus.
we should do. Apart from that, we can left, and first year we will left at for the last. For these
Yes,
approach. And what about other subject we can not normally we are doing?
I left pathology too because I was short on time, and medicine and pharmac said that covered it for me. So I left pathology also. I covered only like one fourth or half of the Qbank. So my total Qbank, I only covered around 60 to 70%. And that's okay.
So thanks a lot, sir.
Yes.
Manya?
Hi, congratulations.
Thank you.
Yeah, so actually, I started preparing since last 3 months. I didn't prepare in my internship and I got a rank of around 46K without studying anything. But I realized that after I started preparing, my GT scores are dripping for like 46K. I think I got around 127 correct. But after I properly started preparing, maybe I think some 7 or 8 subjects I've covered so far last 3 months. But after I've started preparing, my GT scores are really dipping, and I want to know why that happens, or is it natural, or what can I do to overcome all of that? Thank you.
Yes, so this is a very common query. Like if you've got 150 and you're repeating, you don't have to study for 10 more questions. Like you don't have to study for 10 more questions to get 160. You have to study for all the 160 again. So it's completely normal for your GT scores to fluctuate right now because you haven't even completed your first sheet. Your GT scores will only start increasing when you start covering all the 19 subjects in 3 months. And this is not just for me. Everyone, I had a study group. Everyone, when we started completing 19 subjects in 3 months, I say after your read, your GT scores go like this, like straight up. Then you complete one more read, it goes up. I say it's just like after one read, fast read, you will remember more. Like if you're covering all the 19 subjects in 1 month, you'll of course remember more from the all 19 subjects. So then your GT scores will increase, not right now.
Sure, thanks a lot.
Chitra, what was your mindset while being isolated from everything? Because most of us are isolated without any gym or outing, etc.
Yes, so it was obviously not that great because you're not going out, not meeting anyone. But like you all have this platform called virtual library. So I went to a physical library. So whatever like this platform, whatever interaction you get, that is enough. So 1 year you just tell yourself that I've left everything for this exam. This is very important to me. And then like-minded people, you surround yourself with like-minded people. Be focused, crystal clear. You want this, whatever you want, you will crack this exam. Tell yourself ki no one is going to wait for you if you burn out, if you are tired, and you just push through. Every day you just push through, and I'm telling you, you'll get the result. Just push.
True. Can you please guide me to about active recalls?
Yes, so active recall is not that complex of a concept. It's just that whenever you're reading, instead of passively reading the notes, you see if you can recollect it, like actively recall it. It's in the name only. So what I did was when during my first year, I started making questions in detail. In OBGY, I wrote questions. Ki when does fertilization happen? At what age of the embryo? Like you get the point. Like I wrote in detailed questions for each topic and then just revise them during my second read. I started answering those questions, directly take up the questions and actively recall it. See if you remember the concepts. If you don't highlight that point, I am not remembering this, I'm weak here. So you'll pay extra attention next time. That's it.
Okay. And we have, I think, in the whole virtual library, we majority are post intern or interns only, but one or two have joined from prof also. So there's the question from prof. Sir, I am now in third year. Can I do system-wise integrated approach like for cardiology, anatomy, physiology, patho, pharma, medicine? I have doubt that if I do like integrated approach, I won't be able to finish OBG and surgery subjects. So please tell, and should I make concise notes by adding to rapid revision?
Everyone, all the interns and post interns, this is for you also. Go for the integrated approach only after you've covered all the subjects once and you're at least a little confident with it. Like, I wanted to go with the integrated approach in my third or fourth read, but then all the postings and all, I couldn't go for it. So you only go for the integrated approach later on. Right now, just focus on covering all your 19 subjects. Don't complicate it too much. Just do what is given to you, master that, and you will get the results.
Yeah. I think one more question majority have the about FOMO. BTR is great, DBT is great, every platform is a great. But if someone is using some platform, they should not have FOMO of other platform. So how you deal with FOMO? Because nowadays BTR, everyone is doing BTR. So you also might have gotten that FOMO, na? How you
Yes,
deal?
did. I was also very attracted to BTR, but then I just saw that I've done dams overall. Entire year I've studied dams, and DVT has the same table. So what will be easier for me? It was definitely DVT. BTR is also a great source, great for Marrow RR users and for Cerebellum users, but for dams, DVT is much easier. So just don't go in the FOMO and just stick to what you're doing. It's actually very simple. Whatever you've been reading since the first day, just keep reading that, and that will get you the results because it's an exam of mastering what you've already read. In the end, we don't remember and we are not able to apply. We make silly mistakes. Whatever you're reading, just practice that over and over and over again.
True. There is no need to go in FOMO. How much time does it take to complete 6 reads?
For me, it was till NEET, I completed 6 reads. First read 6 months. Next read you aim for 3 months. Then you go 1.5 month. Then you go 1 month, and then 15 days. I say like this. You fit in your reads. You have to go for repetitions more. I've found this that if you say ki I can't read fast, I'll go for quality. So you will get 4 reads. But the person who prioritized quantity over quality will get 6 reads. And it generally I'm saying, of course, no hard and fast rule. Generally, the person with more revisions, quantity over quality approach is winning in this exam.
True. Like how to review customs, like a set of 50 questions, how long should I take it to review and finishes PYQ as a pulse and a long explanation, and I'm taking a long time. How should one go about?
Yes, so if that question, reviewing custom module should not take you more than, let's say 50 questions should not take you more than 20-30 minutes. Like, as you have to go by a speed that is higher than your competitors. Competitive exam, this is a competitive exam. What matters most is time management. Go for it more faster than your competitors. Complete the module in 40 minutes because I'm guessing you're doing it at normal difficulty. 40 minutes is more than enough for a set of 50 questions, and review it in 20 or 30 minutes max. Max, I'm telling about. And if you find it's a very huge explanation, just read the key points or scroll. It's not necessary that you should learn every single questions. You're practicing your MCQ solving skill. And MCQ solving skill matters. Trust me, it matters in the exam because NEET is not going to be you've seen everything. Like, I'll tell you, if you're solving Marrow Qbank, after a point you know the questions. Like subconsciously you know कि ये Marrow pictures are repetitive, the images they use, they are repetitive. You know before the questions, there's a man with his armpit, and you know whenever that man comes, the answer is going to be erythroplasma. So that isn't going to be the case in NEET. You need your MCQ solving skill a little high. So aim for that. You don't memorize everything. Go for what you have done repeatedly.
Okay. There are two questions. I will club both of them. How many GTs do you give, and was there a Plateau for you? How did you overcome the Plateau of GT scores?
Yes, there was a plateau for me. It was around 130. My scores became like stagnant, and then I was also questioning why are they not going up. But then I found out that every subject, if you cover in 3 months, your score like literally goes up. You cover in 2 months all 19 subjects, it will go up. Like it's in the shorter amount of time you cover all the 19 subjects, your score will just jump. So that is the secret to overcoming the GT plateau thing.
But प्रैक्टिकलिटी मतलब नोट टू हर्ट एनीवन बट इतना इजी नहीं है कि एक रिवीजन किया और स्कोर बढ़ा. बहुत सारों के नहीं बढ़ रहे, नहीं बढ़ते हैं. दैट इज आल्सो इशू ना.
हाँ, फिर वो एनालिसिस करना है. यू हैव टू एनालाइज कि वेदर इट इज अ फैक्चुअल एरर or whether it is a recall error, a factual error or application error, and then you mend the loopholes you have. Factual, you just need one quick read, and if you have a application error, you need to solve more MCQs on that topic, watch video lectures, strengthen your concepts.
True. Sir, if I start from now, do I able to crack NEET PG 26?
So if you want to start from now, simple, go for only RR. You have to aim for 4 reads. RR is short, it is doable. 4 reads you can definitely do. Focus on MCQ solving and GTs. They will make the difference in your journey, because whoever is starting now won't really focus on MCQs and GTs. You don't do that mistake. Start if you're a post intern. May I know if you're a post intern or intern? Post intern every 15 days GT. Intern you can go for every 30 days and then increase the frequency. But post intern, definitely all of the post interns watching this, you should have a GT frequency of 1 in 15 days. And then you just, in the end, you consolidate everything in the 15 days, you'll get under 10K, trust me.
Okay. I have studied only 5 subjects so far, and now it feel like how will I complete the whole course?
So you have to finish 19 subjects in the next 3-4 months max. I'm telling you, because if you extend it further, if you keep extending it, you will end up doing 4 reads, which is not bad at all. But you could have done 6 reads. Now, in 6 reads, you will get a rank under 1K. So just push a little bit and you will get under 1K, 1K any branch you want, any hospital you want. That is the dream, right?
True. So yeah, I think we have completed all the questions. Anyone? You can unmute yourself. You can ask your queries if someone is a man.
Used to revise daily in 1 hour, specifically 1-2 hour, especially for revision, right?
Daily?
Daily, like you are reading a current subject, like you are reading surgery. So you last year's subject was actually OBGY. So you revise 1-2 hour daily like this.
No, whatever revision I did was through the modules questions I saw. Now let's say every day there should be like you should be solving around 50 MCQs. So that is up to you. If you're going for the whole Qbank approach, solve 50 MCQs from the previous subject that you've studied, or solve the 50 from custom modules. Then whatever 50 you solved, you review them like that, and that will be your source of revision. Nothing we don't need to really complicate it that much. You just need to keep focus on completion more. Revision part you can do after 1 month. You see it again. The one strategy I told you. Like after you complete OBGY, 1 month later, one day you give to OBGY. That's it. Daily revision and all. It will get too complicated for you to also handle.
Thank you, sir.
True. Yeah, and we have like Inicet in 10 days. So how to go about this 10 days for Inicet?
So if you're aiming for INICT seriously, 10 days, I will suggest that you just start covering. I'm assuming you've covered the PYTs. If you're aiming for INICT, PYTs are really important. And in these last 10 days, you should go for however you can, maximum preclinicals focused. Whatever you find difficult, you cover that. Like all the first year and second year subjects are very important. Whatever you find difficult in them, you prioritize them, and you give 3 days for third and final year, and six and a half days for this. preclinicals, because patho say 25 questions come, so you can't ignore.
Is mastering topics of AIMS 10 years, NEET PG 5 years, FMG 5 years, and first aid, it is enough to get a decent rank? बचा ही क्या फिर?
हाँ, बचा ही क्या है? That is too much for if you're aiming for NEET PG and FMG, that you don't ignore. If you're aiming for INICT, I will suggest go for 7 years, because INICT is very repetitive. You will see 19, 20, 21, same question is repeating in a different format. So for INICT you can go, but 5 years, 5-6 years, it's enough. FMG also.
अब फर्स्ट एड जरूरी है?
See, I will say the same thing again. Like first aid, NEET PG oriented resource nahi hai. So just go for everything that is NEET PG oriented. Same page you read 2 times rather than reading first aid. Just read your notes again. That will benefit you more because they are catered to NEET PG. So go for less stuff, but read it again and again.
One more question is, hi sir, I got 131 corrects, 38K rank this year. How can I plan for next attempt?
Next attempt, if you have started, I will tell you to do 6 reads. 6 months my first read you should finish, and then the next like 3 months, 1.5 month, 1 month, 15 days, like that you can plan. If you haven't started, I've told you the strategy for that too, but I think you've started. So like, what exactly do you need to know in your plan? I will answer it directly. Like I didn't get.
Yojana, you can unmute and ask.
Yes, sir.
Yes.
I didn't start, sir, actually. I took some breaks, sir. I'm about to start, sir.
Yes, so you can definitely go for RR if you're using Marrow, Cerebellum.
Yes, sir.
RR.
I read Marrow RR, sir.
Yes, Marrow RR, go for it. And
Okay.
if you studied previously in the last year, then you can go for 6 reads. Ideal is 6 reads. If you can do up to that, then it is perfect. And I told you, do not ignore the GTs and MCQs, because everyone is reading Marrow RR. You see, all your friends are also reading Marrow RR. Everyone is reading RR, Marrow, everyone maximum. The difference will come in MCQ solving skill, what you are able to solve in the exam under the pressure. So you need to start for that now only. 15 days, every 15 days GT, go for a holistic Qbank approach till 5 months left to the exam, then shift to subject tests and custom modules. Till then, focus on MCQ solving.
Yes, sir. Thank you so much.
Bakshi?
सर माय क्वेश्चन वाज सर, जैसे अभी एग्जाम आते आते जैसे सर मैं एफएमजी हूँ, तो मैं ऑलरेडी जब मैंने लास्ट टाइम एग्जाम दिया था, तो सर लास्ट के 1 मंथ में जो मैंने साल भर पढ़ा था वो मैं एंड में रिवाइज नहीं कर पाया था, जस्ट बिकॉज माय सोर्सेस वर वेरी बिग. सो अब मैं नीट पीजी के लिए तैयारी कर रहा हूँ सर. तो सर मुझे एक ही क्वेश्चन है कि सर जैसे ये अल्टरनेटिव्स आ चुके हैं अभी, जैसे मिशन एक आ चुका है सेरेबेलम का, या फिर तो सर आर दीज अ गुड अल्टरनेटिव टू bypass these lengthy texts of RR and just get to the exact point and just solve MCQs? Because sir at the end I'm searching something कि लास्ट के 1 मंथ में मैं साल भर पढ़ी हुई चीज एक बार तो भी पढ़ पाऊँ. बिकॉज मेरे साथ वो गलती एफएमजी में हुई थी, क्योंकि मैंने साल भर पढ़ा पूरा, बट आखिरी के 1 महीने में मैं पूरा वो पढ़ नहीं पाया. बट पीजी में तो एटलीस्ट I should be able to study it once. So, sir, can you just put a limelight ki are there good alternatives of taking shortcuts rather than doing Marrow ke RR या इसके RR या उसके RR?
Oh, what source are you currently referring to?
Sir, I'm doing Mission of Cerebellum, sir.
And you want an alternative to that?
So, sir, I'm asking, is this a good alternative to these lengthy texts of जो दूसरे platforms है? I mean, I hope you understood what I'm trying to say.
Yes, but Mission of Cerebellum is your main source for now?
Yes, sir.
Can you tell me one subject mission, how many pages are there?
Sir, I'll tell you, like if I take a normal subject of anatomy, sir, it has 5 days of anatomy. which is sir roughly like 400 slides. Sir puts that in 400 slides. So sir वो around 5 days के अंदर एक पूरा एनाट खत्म होता है, तो which is roughly around 400 slides, which I take from a different RR. Even if I take Ashwini sir का RR from Marrow, sir, it is more than that. There's a lot of text, and sir, that is not revisable practically before the exam. So that's what I'm asking ki, sir, should we jump to such alternatives which are coming in market right now, जिससे things easy हो जाए, revisable हो जाए at the end? वो मुझे बस पूछना था सर कि
See,
ट्रस्ट कर सकते हैं क्या हम इन चीजों पे?
honestly speaking, there is no one correct answer. Like if there was someone else instead of me, he would have told you a different answer. But for me, it is more about reading what you've read again and again. And see, our NEET was difficult. Last year's NEET was a level down, but competition is so high that last year's NEET, even if it was difficult, the cutoff only fell by like 2-3 questions. So what I'll tell you is go for RR, Marrow RR till the end, because you need to have an edge over the competitors, right? This is a competitive exam. You don't have to pass. You have to beat the competitors. So don't switch your sources. If you're doing Marrow RR, do it till the end. And if you're using Cerebellum, go for Cerebellum RR till the end. Do not switch your source. That will only lead to more confusion. And
Trust
if
your
you Yes, if you want to do Marrow RR, revise it in the end, or Cerebellum RR, if you fail to do that in 1 month, what I'll suggest you is you start in Marrow RR only, you start annotating the points you find difficult and do only the points you find difficult. That's how you reduce the length of the notes.
Thank you, sir.
Yeah, Mayank.
Congratulations, sir. First of all, एंड सर मेरे एक्चुअली दो क्वेश्चंस हैं. पहली चीज की लाइक लास्ट ईयर मैंने इंटर्नशिप के साथ सिर्फ बीटीआर किया था क्योंकि ज्यादा टाइम नहीं था. एंड दिस टाइम आई एम डूइंग मैरो आरआर. तो अभी लाइक 6 सब्जेक्ट्स कंप्लीट हो गए हैं एंड आई एम नॉट एमिंग फॉर दिस आईएनएस एट नवंबर. तो शुड आई स्टिक विथ माय शेड्यूल की कंप्लीट करना है सब्जेक्ट्स को, या फिर आईएनएस एट पास आ रही है तो एक बार फिर से बीटीआर रिवाइज कर लूँ जस्ट बिकॉज कि आईएनएस एट आ रही है.
I think you should revise BTR again for Inicet because and aim for November INICT. Like just aim for a random rank, like let's say 15K, 20K. Because what is the mentality that exam is coming, so the pressure is there. So we use that pressure. Why unnecessarily waste the pressure? Just use that pressure ki 10 days mein there is November INICT. I want to rank under 20K. Read every pura BTR again in the last 10 days and go for the exam. And then continue your schedule. Like 10 days won't make a difference, right? Just use the extra pressure to put pressure on yourself and cover more.
ओके सर. एंड सर सेकंड एक और चीज लाइक जैसे मैं मेनली मेरे फर्स्ट ईयर एंड सेकंड ईयर सब्जेक्ट्स अभी कंप्लीट कर लिए आरआर से. एंड आफ्टर आईएनएस एट आई एम थिंकिंग कि हाँ मेजर सब्जेक्ट जो बिग 4 हैं क्लिनिकल सब्जेक्ट्स वो कवर कर लूंगा. मोस्टली नवंबर एंड और दिसंबर तक हो जाएंगे. एंड व्हाट आई एम थिंकिंग कि आई लीव द शॉर्ट सब्जेक्ट्स एंड एफएमटी एंड ईएनटी एंड आई जस्ट डू दैट फ्रॉम बीटीआर ओनली. तो इज दैट ओके कि आप फिर मैं 5 सब्जेक्ट जो शॉर्ट सब्जेक्ट हैं और एफएमटी एंड ईएनटी को भी आरआर से करूं?
I think you should go for RR because I'm telling you, NEET level is going up. NEET UG was also difficult last year. NEET PG was also difficult. And you have to be prepared. The exam level is going up. Like sirf BTR, it can happen that it will be enough. But with RR, you leave no doubt. Like you're doing everything, so there is no doubt that will be enough. Definitely. In BTR, there is a chance. So why take the chance? You're repeating 1 year, you're putting in so much hours. Just do RR, and if you have a difficulty in covering that much in last 1 month, I've told you the strategy. Just annotate the points you forget and read only those. What you remember, you'll remember. Abhi, if you know कि fertilization जो भी ब्लास्टोसिस 4th डे पे 5th डे पे आता है, वो अभी भी मुझे 3-4 महीने हो गए तभी भी आई रिमेम्बर. So no need to overcomplicate.
Okay, sir. Thank you, sir.
Yes.
Krish, or what is the pronunciation?
Yes, sir. Congrats on your rank. I had a doubt, like I've completed my Marrow RR, but some subjects like take like off that, for example, I feel like my concepts are not good. So should I do the main videos or maybe change the faculty? Like which would be better?
Don't change the faculty at all. Off-time was a difficult subject for me too. What happened was I could not go for the main videos. Directly read the notes. So what resource are you referring to, if I may ask?
Marrow, sir.
Marrow
Marrow
RR?
RR. I've done the main videos in third year, but still I feel like it's still difficult. So maybe I'm not able to answer the question. So should I change the faculty or should I just do the main videos again?
I think you can stick to Marrow RR, and what you can do is increase the question solving. And then if you feel still you find it difficult, you just read the Marrow RR again. Because of time I was also facing the same difficulty. I felt it was weak till the last day. And what you can do, whatever subjects you find, like of them is your weak point. In the last 1 week, you do the entire Marrow RR once. Entire for this subject only. Rest of the subjects you're only doing the volatile points, but off time give the extra time, do the entire subject again. I did this for off time, ANAT, and PSM. And in off time, I scored every MCQ I scored right. So even if your subject is weak, you can revise it just 7 days before the exam and it will work for you. Switching faculties will just create confusion because you have already the visual memory. In third year also you've studied off them. Now you've read the RR. Switching will be just creating more confusion.
Thank you so much, sir.
Is this approach good? I started with BTR and then planning to do rapid revision and add on the extra points. I am able to understand the BTR well and read some RR and it was smooth.
I think if you're going for BTR and then RR, this is the adding approach. Like there are two approaches. You go for RR or main notes first and then BTR, which is the cutting down approach. You read this much and then read this much. If you're doing BTR and then RR, this will be the adding approach. So there is no one right answer for it. You can either do adding approach, which is the BTR and then RR, or the cutting down approach, RR and then BTR. Personally, I would say 80 to 90% go for the cut down approach. So you should go for that because the majority is going for that. It is a proven technique. And I myself have not done the adding approach. So that will be my suggestion.
True. Tina?
Congratulations, sir, on your rank. So I am a DBMCI student and I have attended offline classes, made my notes and have prepared for 1 year and I have ended up with a rank of 39,000. So after my analysis, what I understood was I have not thoroughly grasped the concept of my notes itself. Like I am having some gaps and loopholes from my notes itself. So what the decision which I took was I have taken test and discussion from same DBMCI since the faculties will be same and follow their schedule and just strengthen my concepts in my notes. But my seniors and everybody is suggesting me to have ATR because that boosts your rank. But for me, the issue is I kind of got habituated to the visual memory of my previous notes. So what right now I'm doing is that if a topic I am feeling difficult or not told in my notes, I'm just going back to BTR, just reviewing that specific topic, or if any diagrams or any tables are well given there, just adding that to my present notes. So I'm ultimately planning of making a single resource by just selective approach from BTR because doing BTR totally, I think it creates more resources and kind of makes me confused and panic at the last moment because since this is my drop year, I don't want to do any mistakes. And by listening to whoever followed BTR, kind of gave me a bit FOMO. So is this the right approach which I'm going for?
See, you're using the DBMCI main notes.
Yes, sir.
Yes, you should continue with the main notes. I myself did DAM's main notes till the end, and DBMCI DAM's has similar size. Till the end, I did the main notes. And BTR you can use in that way that instead of adding to your notes, that will just clutter it more. Main notes are already very vast. Do not add to your main notes, I would say. In BTR only you mark the tables you like, the things you feel are volatile, and that you can just read it from BTR. But when you go to add, your main notes become too bulky. You see, like, too many things are going on. And in the last 30 days, when you have to cover everything, then the problem starts. Till then, you will be very happy. But in the last 30 days, you have 1.5 day per subject. So then if you've cluttered your notes, you'll face the difficulty. So I'll suggest, if you're adding and it's limited, then it's fine. But just don't overdo it and clutter.
Okay, sir. Thank you, sir.
Okay, I think we have covered almost every aspect. This last question we're gonna take: how do you keep yourself motivated throughout the journey?
So it's the same thing. Your parents have been providing for you for 20, 25 years. You have to see the happiness in their eyes. Just aim for whatever, how much ever you can do. Push yourself past your limits. Just aim for the sky. Whatever you do, don't stop. Detach from the results. Just completely detach from the results. Whatever your aim should be, I've pushed myself the farthest in this 1 year. Whatever result I get, I'm going to accept it. Just give it your all. Do not think at all. Just give it your all. Keep pushing. In the night you feel abhi mere se nahi hoga, I can't do it anymore, you just shift to passive video watching, whatever it takes. Do not disobey that you will sit to the library till 11 p.m. No matter what happens, you will not get up. No matter what happens, you will keep pushing. Whatever you do, you don't stop. You don't stop. Whatever happens, just keep pushing, and that will be the discipline that gets you through. Motivation dies away in 6 months, in 4 months. Just the discipline. You never disobey your end time, that I'm going to wake up, and then wake up. Whatever you say, you follow it up with your actions. That's how you gain confidence. If I tell myself I'm going to wake up at 9 a.m. tomorrow and sit till 12 in the library, you do that. Doing that gives your mind the self confidence it needs to crack the exam. In the exam, you will be confident because you'll do what you said. You said you will crack the exam, you will crack the exam. You said that you will study for 9 hours tomorrow, you will finish, and that tomorrow, even if you don't finish, you study for 9 hours, you go for it, you tell yourself, I'm going to sit for 12 hours, you sit for 12 hours. Don't disobey the end time. Wake up on time. Whatever needs to be done, get it done. That's the only mindset you need.
True. Just last question, sir. Using
Yes,
DAMS, notes, and Marrow Qbank and Marrow GTs, is this approach good? And 20 netbook BTR. बताइए.
Which? I didn't.
Question is कि using using DAMS main notes and Marrow Qbank and Marrow GTs, is this approach good? And with 20 notebook BTR.
Yes, it's definitely good. I did the same. Marrow main notes and DAMS main notes and Marrow Qbank. So it's enough, more than enough.
True. So thank you so much, Dr. Sumit, for these wonderful sessions. The energy you have is amazing, and the clarity of thoughts, it's seriously amazing. Thank you so much. Thank you so much for this session.
Yes,
Thank you so
thanks
much.
to you too. Thanks to everyone who stayed till the end. It means a lot,
Thank
genuinely.
you so much. Bye. Take care. Thank you so much.
Bye bye. Thank you.